So, coronavirus in the UK. That is the UK's busiest railway station in terms of passengers, right? And look how empty it is. This video is about coronavirus in the United Kingdom. So this was quite close to rush hour, and look, there's virtually nobody in there. So the question is, why is coronavirus just so prolific in the United Kingdom, particularly England, right? Northern Ireland, Wales, Scotland have been fairly successful. Scotland's quite low. They had a severe early lockdown, hardly any easing, even though Nicola Sturgeon herself broke the rules flagrantly. Now, that's good for North Britain insofar as there are relatively few coronavirus cases and deaths, but bad for Caledonia in as much as that's obviously tanked the economy, even more so than South Britain. But obviously she gets a subvention from South Britain. Though she wants to leave the United Kingdom, wouldn't get that anymore. No guarantee to get into the European Union if she split up the UK. Even if she did get in, it wouldn't be immediate, and on and on. So the UK's got the 5th highest number of coronavirus deaths in the world. It doesn't have the 5th highest population, it's got something like the 20th highest population. But per capita, I think I'm right in saying it's the 2nd highest in the world. Mexico's the highest per capita number of coronavirus deaths in the world, partly because their obesity is even worse than the United Kingdom's. So it's bizarre because the UK's had a number of lockdowns, fairly strict, and yet it still hasn't paid major dividends. Got a very good healthcare system. I just can't think what else is going wrong. Okay, the test and trace wasn't good enough. The government vacillated about the first lockdown in March last year. That was a problem. The whole eat out to help out thing was probably a mistake and probably good for the economy, but then it caused it to come back more, coronavirus to come back more a little bit later on. There was a lot of confusion about what the rules are, and then the policy kept being changed from week to week. We were often in darkness of what the rules were. Boris Johnson himself was muddled up about them, which didn't inspire confidence. Then his guru, Dominic Cummings, right at the beginning of this whole crisis, he broke the rules on a massive scale, driving hundreds of miles. Now you might say, well, that really has no effect on the spread of coronavirus. One person in a country of 70 million. But the hypocrisy obviously undermined confidence in the whole system. And if he's going to break the rules in a huge way and not be sacked for it, well, then I'm going to break the rules, so many people will have been thinking. So the UK certainly paid the economic price for it. Unemployment in London 7%, obviously worse in some parts of the country. 7% may not seem that bad. Okay, it's the highest for 6 years. It's not horrific, but this is what's puzzling. Is it because the United Kingdom tells the truth about coronavirus statistics, whereas certain countries lie about it, particularly totalitarian countries? Could be that. As I say, obesity rates are fairly high in the UK. That exacerbates it. The United States never really had a national lockdown, and so some states did. That's long gone. Why is it so bad here? Well, the United States had 400,000 deaths, the United Kingdom 100,000 deaths, but as the United States has got 5 times the population in the UK, you'd think that the UK would have a 5th of the deaths, but it's got rather more than that. It's got about a quarter of the deaths that the United States has suffered. So there are other possible factors. Well, the United States has got a huge land area, therefore the population is more diffuse, and certainly in rural areas it's not going to spread very fast. Now, severe cold will spread it more in certain parts of the United States, although there are some states where it's actually warm year-round, where you think it'd be less of a problem. So what to do? How on earth are we going to get out of this? They're talking about primary schools coming back to meet in person, not just have online school after February half term, dependent upon how the coronavirus situation pans out. But schools say, well, please give us a roadmap. These are the indicators. If the R rate falls to whatever, then we will reopen. But the government is not committing itself even to that. They could make a provisional decision, which they keep under review, where they retain the right to say, no, they're not opening after all, after February half term if it goes wrong, or whatever. But anyway, we just don't know when we're going to get out of this mess. So it's quite dispiriting. My Chelsea Flower Show ticket rolled over from May this coming year to September this coming year. I think I'm right in saying the UK was the first country in the world to start vaccinating, and using that Oxford Zeneca one. or the AstraZeneca one, Pfizer, and a few others. Now, I can't remember which one's which, but one of these vaccines got a downside in as much as it must be kept at minus 70 degrees Celsius. So other ones can be kept in an ordinary fridge. There is prices. Every vaccine needs 2 injections. So roughly the 20th of December, the first people started being vaccinated, the very clinically vulnerable and nonagenarians. And those obviously moved down to octogenarians, going on to septuagenarians. Certain, obviously, doctors, nurses, those who come into close physical contact with patients. They said, well, what about other key workers? Police officers have to be around. They can't do their work remotely, have to come into contact with the members of the public. People said, what about shop assistants then? Some transport workers, social workers. Now, we can't have everyone as a priority, or no one's a priority. How about teachers? They're going to go back in school. Some people are teaching at the age of 68, so they're getting rather vulnerable. And I thought that the coronavirus statistics would go down, partly as those most susceptible to the disease have already died, but it hasn't turned out that way. What else was I going to say? So yeah, you get the vaccination and you don't get any immunity at all at first. It takes 10 days for it to start building, and it builds up to about 33%, if I got this right. Now, what does 33% mean? Does that mean you've got a 33% chance, a lower chance of contracting coronavirus than you otherwise would do? I'm not sure. Does it mean that if you do contract it, you're rather less likely to die of it? Again, I'm unsure about that. I'm not a clinician, as you may have gathered. And then you get your second injection within 12 weeks of the first, and that'll build you up to 95% immunity. There is no full immunity. And it's been quite comical what the Russian government is saying about this whole thing, saying that, yes, when one foreign vaccine said it had offered 92% immunity, then the Russians the very next day said that their Sputnik V does 93%. When somebody else says theirs offers 94.5%, the very next day Sputnik V suddenly said that their vaccine offered a 95% immunity, and so on. It was just puerile. But there we go, this ludicrous one-upmanship. Who can believe these absolutely transparent attempts to trumpet their chauvinistic prejudices, where they have bent science rather roughly to fit this hyper-nationalist narrative of Russian supremacy. And the very name Sputnik is meant to be redolent of when Russia scooped the world with how that first satellite going all the way around the globe way back in the 1950s, the V for victory and stuff like that. 50% of Russian doctors said they wouldn't put any faith in their country's vaccine because the science has been twisted to fit a political agenda. The FSB, that's the Russian Internal Intelligence Agency, has got offices at all academic institutes, including those of medical science, just to try and police political orthodoxy. So it's gone back to the Soviet era in that sense, neo-Stalinism, and truth, justice, objectivity. These have all been sacrificed for the sake of jingoism. So anyway, I was mainly hoping that the coronavirus deaths and infections would start to drop off dramatically, because those first people who got vaccinated around the 20th of December, by the 20th of March, they'll be up to 95% immunity, and so it will really, really drop. Now, vaccination was quite slow at first. The aim was 350,000 vaccinations a day. The UK was only hitting 150,000. Finally got up to 350,000. Now they're vaccinating 500,000 a day. But there's more could be done. And they said they've got lots of people to volunteer to give these injections, retired nurses, dentists, I think pharmacists allowed to give vaccinations, anyone, and these nurses would be spared that return to practice course, or doctors coming back out of retirement, just to really speed it up, and for which they will not be paid. And then we'll get the whole thing going very fast. So over 100,000 deaths now, and also look at excess deaths. Yes, there are also deaths occasioned by things like cancer screenings being delayed. Various operations and treatments were delayed because coronavirus was so exigent, and so something which was curable has become inoperable due to this dilatory response to various otherwise treatable conditions. So you see how little traffic there is in one of the busiest streets in London, right opposite Waterloo Station. Sometimes it's becoming like a ghost town. It's surreal. It's like an early Sunday morning permanently. That is good for cycling, for instance. So we shall see whether we're going to have that sort of herd immunity. Remember, Boris Johnson was touting that idea in March 2020, but he very quickly backtracked on that one. And had lockdown come in a couple of days earlier, it would have made a major difference. like Republic of Ireland, we did it slightly earlier. That helped as well. We had allowed people in from a rugby match. We had allowed people to go to the Cheltenham Gold Cup, that horse race in England, and that made the situation appreciably worse. New Zealand said they only just avoided this. They've only had 27 deaths. So when people are allowed to travel in and out of the United Kingdom, you might have to quarantine for 2 weeks in a hotel when you arrive, or a Briton going abroad might have to quarantine for 2 weeks. People don't want residents of the United Kingdom going to their countries for a long time. We shall see. But anyway, perhaps I'm being over-optimistic and thinking the situation will be transformed by the end of spring, because that's when the vaccine will really start to kick in. And these things, these viruses, they're highly volatile, that they fall down just as quickly as they leap up. I remember I was in Italy in late June, my last day in Italy, there were 3 coronavirus deaths in Italy when there'd been a couple of thousand at the peak in April. So, I mean, are we at the peak or are we past the peak? Because we had 1,600 deaths. What a grim milestone in a single day here in the United Kingdom. And then it fell to 600 deaths. I thought we rounded the corner. Then it jumped up to 2,200 deaths. I just can't believe how horrific it is. What a hecatomb has been piled up. And I mean, these mobile refrigerated, well, obviously refrigerated morgues, these vans for bodies, as a very rough indicator to how bad it was. I remember a year ago I would have seen 1 hearse a week. I remember in April I was seeing 1 hearse a day on average. So here we are coming up to one of London's primary tourist attractions on the South Bank, and of course it's closed, so the tourist industry has been decimated, at least hotels. Now the high street has been dying for some time, but this may well have been the last nail in the coffin. People have got used to online shopping for the better part of a year. And I don't know if they get their rent paid, because they're often renting these shop units rather than owning the building, and it's just not worth it for them. So we're just going to have to switch to doing all online. Have a warehouse somewhere where it's cheap to rent one, and follow the Amazon model, and perhaps that's the way forward. Shopping in person's not as fun. So retail's done very poorly. Why would you be buying new Glad rags when you can't be showing them off? You're not socialising, no parties to go to, don't have to go to the office in person. But let's remind ourselves, what are the upsides of coronavirus? Because the whole idea of commuting is over, it seems to me. I don't think it's going to disappear completely. Yes, there are some in-person jobs you'll need to do. But office jobs, again, I think there will always be a few offices, a few people in the office. But we see that it can work quite well, working remotely. So why don't we do that? Save time, save money, save the planet. It's a win-win-win. Because commuting is often the worst time in a person's day. It's very stressful, and the person can arrive in a foul humour at work, having been snarled in a traffic jam. I remember over a year ago thinking, how's London going to solve its transport problems? There's such congestion, new tube lines, new overhead railways, more lanes on the motorway, things like that. And at a stroke, it's been solved. So I think we'll never go 100% back to working in person like we used to. Yes, there are some jobs which require physical presence, others don't. I think it's good to have offices and a few people to go in, people going in like 1 day a week on average, but then that's got implications for transport, because fewer passengers, less revenue for them. I suppose they can have fewer trains, less frequent trains, fewer carriages and buses and stuff like that. But then will people start driving a bit more because it'll be more viable, be less traffic on the roads? Cycling will be a lot more viable, I suppose. There are fewer buses and fewer cars going, and then more cycle lanes have been set up. Cleaner environment, there's less noise pollution, there are all sorts of benefits. Fewer planes coming in and out of Heathrow. Heathrow has never closed. London City Airport closed for a while. And Heathrow is down to 5% of its usual passenger numbers, as was Transport for London in the depths of lockdown way back in April. Remember to myself and April saying, well, at least it's brightening up now this time of year. Imagine how utterly dispiriting it would be to suffer a lockdown in the bleak midwinter. Well, and so it came to pass. It transpired that we had it about the grimmest time of year, 20th of January being Blue Monday, the most depressing day of the year, because the Christmas cheer has long since dissipated. People have been overindulging in tucker over Yuletide. They had rows with their family. They were cooped up with relatives who they don't like over much. They drank too much. They overspent. Payday hasn't rolled around. The weather is still ghastly, and it's still some time before the next festival, which is Valentine's Day. Anyway, so that's enough from me. I don't know how we're going to get out of this. Obviously, I think it's going to be a combination of the vaccine, social distancing, work from home, masks, hand gel, test and trace. The test and trace system was unfit for purpose patently, was just unable to cope. And I tried to get myself a coronavirus test ages ago, and it has the barcode, and I couldn't figure out where is this number I have to fill on the app before I sent off. Why do you need that number? You know it's me, you sent it to me, you got the barcode. I just threw it away in the end. Clearly I don't have it. All right, so that is me reporting from coronavirus-stricken Londinium, where it has dropped considerably in the last week. Now, one swallow does not a summer make. It might just be a blip. I'm hoping it's not a rogue result, that it is statistically significant. It is part of a downward trend, because when it was rising up, first of all, I wasn't sure if this really was a trajectory or just a one-off. There we go. So goodbye from coronavirus Britain. Toodaloo.